All right. I want to introduce our next speaker. Thank you so much for coming into Colorado Division of Insurance. GBC wants to thank our sponsors, and I'm going to let you take them in.
Hi, everyone. I don't know if anyone mentioned you. Hi, the few of you that are in the room. I am Sara Bencic. I am currently a senior policy advisor at Colorado Division of Insurance, and as of next Monday, I would be actually the Colorado Options Director.
Woo!
Yeah. Thank you. So I'm going to talk through the Colorado Option Program. I had a little survey, but we're short on time, and there's only a few of you in the room, so you don't.
You're right on time. Okay. Yeah, you're only 2 minutes late.
Okay. I thought it was 1:21. So we'll see. Okay. So the Colorado Option was established through House Bill 21-1232. It's designed to improve access to health insurance, affordability of health insurance, and racial health equity for people purchasing health insurance from the individual and small group markets. So this is kind of a new slide, but generally this is like who, what, where, when, why, how of the Colorado Option. So Colorado Option plans are a health insurance option with standardized cost sharing for common services such as primary care, specialist visits, lab visits, etc. In addition to having these standardized cost sharing, which helps consumers compare sort of apples to apples across insurance companies, carriers are supposed to reduce the price of these plans through premium reductions and also include a provider network that is culturally responsive to consumers that enroll in these plans. Health insurance companies have to offer these plans at the bronze, silver, and gold levels in counties in which they offer other non-standardized plans. So if you're not super familiar, the bronze, silver, and gold levels are generally like how the individual and small marketplaces deem sort of the value of health insurance, with bronze being generally the lowest in terms of the consumer pays the most out of pocket towards the deductible or cost sharing, and gold being the consumer pays the smallest amount and the insurance company chips in the most. Okay. So who can buy these? Consumers purchasing insurance in the individual market. So if you don't get health insurance from your employer, or other means, you can purchase in the individual marketplace, which in Colorado is called Connect for Health Colorado. And then employers in the small group market, which is 2 to 100 employees, can purchase these. So as I sort of mentioned, consumers can go to Connect for Health Colorado to buy insurance, and small businesses can go through 2 different ways. You can go directly to the insurance company and buy them, or typically small businesses go to a health insurance broker, and the brokers handle enrollments for those employees. So these plans, Colorado Option plans, were first offered in this year, 2023, and in 2024, open enrollment for both the individual market and the small group market starts on November. So these plans will be available for purchase starting on November 1st for a January 1st, 2024 effective enrollment date. So just to explain a little bit why are the standardized plans, why do we standardize the plans? Why is this good for consumers? So sort of as I mentioned, because standardized plans, the cost sharing across all services is the same. So if you go to a primary care provider, it's, in this case for option plans, it's $0 copays across all insurance companies you look at. So you don't have to think twice about if I enroll, for example, a Cigna plan, it's a $20 copay for primary care versus if I enroll in a United Healthcare plan, it's $0. All those copays and co-insurance are the same across all the health insurance companies offering Colorado Option plans, which means that consumers can focus on things like, the quality of the health insurance company, both in terms of the providers that have a network, hospitals that have a network, and also like the quality of the health insurance company and their customer services. You can shop on your provider network. These provider networks can differ by insurance company. And then obviously, probably the most important, what most people shop on is the price, which for this, we're talking about the monthly premiums that people pay. In addition to making those apples to apples comparison, what's good to know, or what's good about standardized plans is it makes it easier for people to know upfront what they're going to pay. If you know you're going to your primary care doctor for a sick visit, you will pay $0 because that is the copay that is written out for the standardized plan. Yes.
So are the copays more similar to how like a Medicare Advantage plan would be set up, where it's set copayments rather than co-insurance?
Yes. So this is a snapshot of what the benefits look like. Okay. This is a gold. Yep, this is a gold plan. So you can see on the left-hand side, it walks through what the individual deductible is, annual deductible, and then the individual out-of-pocket maximum, and then underneath that is family. So for gold plan, a person has a $1,700 deductible, and then this table shows you all the copays and co-insurance. So generally, more services are copay-based. So for example, obviously preventive care in general has to be $0. But under this plan, you get $0, unlimited primary care visits, whether that's, you hurt yourself, you need like travel vaccine that's not covered under preventive services, you're going in for, you have, cough and you want to get cough medicine like that. So people should know in advance, like this should be $0. And then for this plan, a specialist visit, which would be, like dermatologist, GI doctor, etc., you would know in advance it's $50, which is nice because as someone who has had insurance before where it's either your high deductible plan or co-insurance base, like I have no idea what the doctor charges per visit. Like your primary care visit could be what, especially like with a high deductible plan, $50, or that doctor could have charged $300 and you now owe like $150 of that. So it's nice because you know this in advance. And all of this information is in our Colorado Insurance Regulation 4281. You need more detail, but in general, most of these services are copay based. You can see that lab tests are 30% co-insurance, and then emergency room services are 30%, and both of those are subject to a deductible. But in general, like a lot of those services people use are copay based.
Gotcha. That's awesome.
Yeah.
So this is starting in 2024.
No, they're actually in effect this year.
Okay.
But they will also be offered on either Connect for Health or through broker in smaller market for 2024 as well. So that this information for this plan design information for 2024 is already available, but the plans will be posted. That information goes live basically November 1st. Yes.
Hi, I'm a small business majority. I worked on this policy for small businesses. I know that there was some lack of information coming from brokers who educate small business owners about this. What's being done on that end?
Yeah. Are you Lindsay?
Yes.
Hi, Lindsay. Nice to meet you.
I was going to bug you. Yes. Hi.
Yeah, I'll talk to you later. So we're doing outreach with Connect for Health, and they have broker and a sister network. So I presented to at least one of their broker focus groups, and then they have a broader broker network group that I will present at in a week or two. So they've been having me come to those meetings, and I think as well trying to leverage those, especially those brokers that sell across both the individual market and small market, to try to help us tell us what the problems are so we can help solve them. One, we need to get this information out to the brokers if they don't know that it's available, and two, I know we've gotten some comments from brokers about, for example, mental health. Office visits specifically are supposed to be $0 cost sharing. So if you go see licensed counselor, or the idea is a psychiatrist in an office setting versus an outpatient setting, that's $0, which is a huge deal. If you go to a therapist, it's not $200 or something per visit. And we've heard from brokers that there have been questions or concerns on that. So definitely taking that into account. But in general, trying to use our existing networks to make people aware of it. Because we did hear that was an issue. That brokers weren't telling small businesses that this was even an option, which is hopefully an education issue and not any sort of negative intent. Hopefully it's just...
We're going to hope for that, I think.
Yes. And then obviously reaching out to our partners, you all, probably the Brokers Association, remember their acronym is, and letting them know, hey, this is an option. Please come to us with questions.
Cool. Thank you.
And you said that these plans for the small business owners are for plans anywhere from 2 to 300?
It's 2 to 100.
2 to 100. Okay, 2 to 100. Where could I find more information on that piece of it? Because we only offer, I think, 2 or 3 plans for full-time. We only have 3 full-time employees. So,
what information are you looking for?
So we had a broker that had with that insurance that just went out of business July.
Friday health plans?
Friday, yeah. And now we can't get our broker to call us back. So we've been trying to figure out, but I have another guy. So I'm trying to figure out these pieces, who to talk to.
Okay.
But I wasn't sure if I'd wait till January 1 or if I can get them.
You can definitely probably start talking to your broker now. The plan information, the premium information, monthly premium won't be available generally until November 1st. That's sort of when that information goes live. But you can start talking to your broker now and say,
the broker stuff.
Okay, so you should be able to go. Yeah. But what you want to ask your potentially new broker is what do Colorado option plans look like compared to what we were offering last year? Or obviously once the information goes live, what do they look like in terms of the pricing for plans that are offered by other insurance companies? But it is like other companies obviously have different plan designs, so they're not going to be necessarily the same level of like mostly co-pays or set co-insurance.
Okay.
Yeah, but I can also, I think my email's at the end of this. So you can also reach out to me as well.
First, thank you.
Okay, so these are the insurance companies that are offering Colorado option plans for 2024. So Anthem, which is also here known as Mutual Colorado, Kaiser Foundation Health Plan, Kaiser Bencic, another Anthem plan, I think it's Rocky Mountain Health Hospital Medical Services, whatever RMHMS stands for, and then two different sort of United subsidiaries. And you can see that Kaiser, Permanente, RMHMS, and United Health Insurance are all offered statewide. So if you're not in, some of them are only in like the Denver metro area or certain parts of the state, but a couple of them, I think about half of them are statewide. And I feel like once the information is more publicly available, you can probably go to our website and see like who's offering what plans where. I think there's people in my division are still working on like mapping all of that out for next year or for publication in November. I think this was just here for yes. Okay. Other questions, and I can go back to any slide. Other questions.
Are you ready for Monday?
Starting. Yeah, I've been basically doing a lot of this work.
Yeah, I figured.
Kyle's been doing two jobs, so it's just she's mostly going to have a baby any day now,
yes,
and so I will be doing her other job, and so that's what scares me.
Exciting.
Yeah.
And all those $0 deductibles that just came into play this year, would you say? From that.
So these Colorado option plans were started offering this year, so 2023, and then will continue obviously being offered next year. So this this sort of layout, like the cost sharing and the deductible information changes every plan year. They have to meet the metal tier sort of standards, cost sharing and payment standards that all Affordable Care Act plans have to meet. So there might be some updates to this, but this is what it looks like for 2024. And generally, when the division has to make updates to like change these plans a little bit, so far between last year and this year have focused on increasing the deductible, like moving the deductible around a little bit versus like saying all of a sudden you have to pay $20 copay for primary care. We want people to use these services, and so if people value $0 primary care, $0 mental health visit, that is more important to us.
Yes.
And thinking about consumers versus like the deductible is not important, and that means a lot, but it's a little bit easier when a lot of these services are pre-deductible. You don't think about it.
And that did make it nice when we were shopping just the last couple of weeks, and we saw all the zeros, and it's, oh my gosh, so this makes sense where it's coming from.
Yeah, and I don't have it open. Right, this is the only one I put into this slide deck, but I believe generally these are also similar across like silver plans, which are a little bit more consumer cost sharing, but in higher deductibles, but generally like still $0 primary care, $0 primary care. I believe the specialist said that it's $80 instead of $50, and maybe the co-insurance is a little bit more, but still very much like focusing on those important services, primary care and mental health, behavioral health offices that people recognize. Other questions?
Are they doing something similar for dental as well that you know of, or is that different?
No, I don't think so. There's no, as far as I know, there's no like standardized dental plan being offered. I think dentists still very much like Wild West of what you get. Yes.
Are the group rates going to be based on group rating or underwritten? Do you know?
I don't.
Do the
It's community rating, so it's all through the individual
so
market.
no underwriting.
Well, I mean, the insurance companies themselves, of course, have the underwriting for it, but they're rating it based on the group within the individual market.
Gotcha. Oh, yeah.
Oh no, I'm sorry. No, because it's a small group. But it's community rating across small group, right, Lindsay? Do it better time.
Yeah.
Sorry, say that again one more time. So they're not just underwriting this product. It's in the small group market. Those who purchase ACA plans get rated as a risk pool together.
Got you.
Yes.
Yeah.
Which is what helps keep some of it down, is because you're not just like normally it's just like, I mean, you know this, right? Your small business, what is your risk? That's how we're going to price it. Right? Because it's more like
smaller project overall.
Sure, yeah, absolutely.
That helps relieve some of that.
I'm a big fan of the Colorado option.
I'm just writing a report on it.
Yeah.
So I totally agree with that.
It looks awesome. I mean, I've been doing pedicure for a few years, and it's very similar to that, which I love. It's pretty more.
Yes.
So awesome.
Yeah, it's definitely, I feel like in certain states and at the federal level moving towards these more standardized plans, but Colorado is definitely one of the first to tie both the standardized plans with the standardized cost sharing and the premium reductions that health insurance companies have to be to try to keep, they'll argue, oh, you're giving people more benefits, more expensive. We're saying like, well, you should, you have to figure that out with providers so we can keep premiums affordable to people.
Yeah.